I'm going to bring the meeting to order so that we can get through this very quickly if possible. No one responded to your question, so I'm assuming that no one has right now the anticipation they'll be leaving early. So if we just get things moving, I think we'll be okay. So we'll go right into the roll call. Mary Ann Abadi, present. Dick Kunert. Reverend Edward Copeland.
Present.
Great. Hi, Ed. Danielle Angileri.
Present.
Dr. Bill Gorski. Dr. Terry Giardini.
Present.
Tim Neighbors. Linda Sandquist.
Here.
Advisory members, Wendy Larson-Bennett and Jay Ware. For the record, Wendy made a wave to indicate for those that are listening to the meeting. At this point, we will just inform you that we've had no requests for public comment. So we'll move on to presentations. And this is the Winnebago County Mental Health Board Communications, and Chelsea Glatz will inform us, bring us up to date.
We're switching over. We have host. Okay.
What? I'm sorry, I missed that. What?
I was just making her the host so she can share her screen.
Okay, very good. Thank you.
To do the presentation.
All righty, very good.
Hi, my name is Chelsea Glatz, and I will be doing the communications update. So this is the foundation of our plan. To accompany this, there was the internal communications calendar and the communications plan that the board got in the board meeting packet. I'll do my best so you guys can hear me better. So the foundation is that we've established multiple platforms and accounts. It's been a long process of getting all of these to the point that they are now. The website is on Region 1 Planning Council's website. We've expanded multiple pages, and we've had some evolutions throughout the time that we've been on there, and we're at a very solid state now. The MailChimp is our main form of internal email communication to stakeholders. We've been growing there. The YouTube, as we are broadcasting on YouTube right now. And then the two social media platforms are Facebook and Instagram. Facebook is coming up on a year of it being active, and getting the Instagram account officially integrated with Facebook took a multi-month process. So it's a big accomplishment of doing these streamlined communications and system coordination. So we've been building up an audience and building content. And with that, we've been building up accessibility coordination considerations and developing brands and logos. So I'll be going over those last two next. So accessibility and branding. Accessibility is one of the board values. We take requests and we allow feedback. We have a statement on our website saying, requests for accommodations. We always make sure to include it in our communications. We're by no means, the gold standard, but we're working towards, improving accessibility, and that's why we allow for feedback and, doing best practices. So in the communications plan, it's further explained that we do alt text, image descriptions, which is an example you can see on the screen, and doing captions, which are post-board meetings or before board, like video uploads on YouTube. And we've had ASL at big public events, which was at our award announcement. So prior to me coming on, we had the board vote on a logo. So the green ribbon, which stands for mental health awareness, and the blue was chosen as it's related to suicide awareness. And with taking that, I tweaked it a bit to make it maximized for accessibility. As you can see, the color contrast just shows that the color green and navy blue was kind of adapted so that it is AAA standard or tag, and that's the International Standard of Web Accessibility. Logos don't actually have to adhere to these principles, but it is important that if they're going to be kind of the community up front, and if we're going to have this opportunity to adapt our branding to be accessible, we took that into consideration, which then arose to the two alternate versions of our logo. The navy background, and then it's a complete inverse of the colors, which is the white background version. And the font and everything and spacing is all considered with accessibility. So branding, as you can see, these PowerPoint slides have kind of some branding and recognizable like style. So we've been building up a lot of templates lately. So as you can see, the new board packet, the agenda, the new minutes format, they will have new templates moving forward, and having cohesive style and really making sure that any of our content is recognizable in the community. Us being a new board, is important to, get that our logo out there. And so then at some point we could probably just use the ribbon and people know that is our board. So here's kind of an example of during presentations, some of our, examples of using our branding and logos and style. So I'm going to kind of go over the report a little bit. So from the previous communication plan that was earlier in the year, the target audience with the key concepts and target messaging is consistent. It didn't change. There are some changes in the tactics and platform. The next slide will be the matrix, which is the cross section of that in a chart. The key is right here. So 1x has potential up to 3x's, higher degree of reach. No X doesn't mean that there's no crossover, but it is an area that is lower in connection. So with the communications report, you can see that we've been hitting all of these areas. At times, they're going to be adjusting into priorities that we're going to address and target. So at times, there might be not as much public engagement in terms of communication. There's a lot of internal systems. I may lead the communications, however, it is a team effort, such as the LNC, the special board meeting, which is the press conference. That is a whole team effort. So there's a lot of internal systems that are being done that may not be always public, but we are always making sure that what we're focusing on is the most impactful and the most important to the board's direction of tasks and what we're doing in the community. So the update is that we're doing the addition, which is on the bottom row of the matrix, public engagement events. So that will be kind of more in the spring, since we're going into winter. We'll be very selective in when we choose to do general public engagement events. Those will be to maximize our exposure and kind of more general topics and not specifically a smaller segment of a community. And the additional methods was on that plan, and these are things that we've been doing already, which is surveys, handouts, boosted posts, and our branding and logos. And we've been doing presentations. We've done a couple this past month, and we actually have more planned. So those are to stakeholders, and organizations can actually request for us to give presentations. And two of the biggest things that are coming up in November is that we're going to have the LNC, which is for the funded organizations. And then we are in the work of planning a convening organization to collaborate hosted by WCCMHB. And that will be to foster collaboration for the next grant cycle. And so more information will be coming in the future about those. So kind of the analytics highlights. There's a lot of cross-sectional interaction between our platforms. A lot of the strategies, when there's engagement on one, impacts another or leads to other engagement elsewhere. So a lot of our content is linked through links and buttons. I'll kind of go through some of the highlights. So Facebook is kind of your second website. That is an industry standard. You always got to be active on Facebook. That's just where general population always goes for information. Actually, Facebook will be dissolving likes. Fortunate for us, we actually have a higher follow number than likes. And at 521 is actually just individual profiles. That does not include page follows. So other pages, so the number that's actually visible on Facebook is actually higher. So we've been steadily growing. As I said earlier, November 4th would be our actual 1-year anniversary of having that Facebook page. So here's the top post of 2021. As you can see, that first one, there's that little symbol next to it with the rocket. So that was a boosted post. So obviously that has a lot of reach, and we selectively choose when we boost a post. The second one was shared a lot. That had 9 shares, and that was when we announced the strategic plan and the NOFO. So a lot of far-reaching and very important content is typically shared, and so it gets a lot more reach that way. As you can see, there was 55 clicks on that link of that post. And further down the second to the bottom, that is a reshare of a industry, top level content. And so a lot of those posts can help increase our reach, and they perform quite well. And Facebook and Instagram are integrated together. So a lot of the posts then, and with accessibility, are built in. So there's a very streamlined process of doing content towards Instagram. And type of posts that perform well on Instagram are different. Although the number of 75 followers is low, as you can see, the amount of non-followers we got in the past 90 days, because we're involved in kind of, topics and content of high-level profiles and content. While there are the graphics of the top reach of the past 2 years, the content is typically curated and specific. So we do use other organizations, but we are very selective when we use those, and they do perform well, and it's important to build our audience on those platforms. With YouTube, 14 subscribers, people who watch the board meetings don't always subscribe, so I wouldn't be too concerned about that number. But as you can see, the grant seekers meeting is our highest viewed video. That was, when people were learning about the grant and the application process. And then the second one was May 5th, which was the first announcement of our actual selections of the grant proposals. So they're doing quite well. MailChimp is growing every day. The chart here doesn't actually show, it's after the end of that month. So the purple is when that month has had new ads. So the first big one in November was our stakeholder list that we added. And then we also add towards grants or some other things, or people request to be added, so we will do that. But we have our email sign up buttons on our website and our Facebook page. We had 11 people sign up in 2020, and we've had 35 plus in 2021. So the special board meeting, which was the public announcement, prior to that, we had 15. We had 15 after that. But since the presentations, we've had more people signing up. And since September 1st, we've actually had 8 new subscribers. So it keeps growing every day, and that's really important. So here are some of our campaigns. These are the emails that go out. The first peak is the NOFO strategic plan. The second one is the grant information session update. And then the third one is the grant application update. So that was the last significant update prior to the board meeting, or the grant closing. So as you can see, it was just a reminder post after that. So people who were doing the post, that's why you see the drop down out for that. but the industry standard of open rate is actually only 23%. So we have really great performing email campaigns, and that grant proposal selection updates that have the highest amount of clicks because it directed them to our documents that are on our website. So button conversions, as you can see here, there's kind of two screenshots. You can see down at the bottom that email sign up button. A lot of people, when they're visiting our site, it's on every page except for, there's only a few pages where it's not on, but that is there so that people can stay informed. The first button, which is actually the lower one, that was when we had the first grant proposal selections. That was the first announcement. We had 41 clicks in 1 week, 70 total. The special board meeting announcing that, there was 12 in 1 week and 30 total. And then once we had the funded programs page live, so these 3 buttons at the bottom here, there were 26 clicks in 1 week, and there's 73 total clicks. So they're performing really well. Our website had a few different like URLs or names, but if you combine all of our like home or about pages, it will account since January 1st, 3.3 thousand visits. And that doesn't account for some of the other pages we have on our section of the website. So that would actually be the 3rd most visited website for all of Region 1, which is significant because as you can see in both of these charts, that the homepage will always, for Region will always get the highest, but there's also the land bank, which is an ever-changing site, which always is a very high visited site. The fact that we are up there is really significant. So if we look at just 1 month of visits in January, which was the announcement of the grant, we were the 2nd most visited site. And then the week after the special board meeting, we were the 2nd and 4th most visited site. So that is a 1 week view. So we've been growing and performing well on all these different platforms. So any questions?
Can I have you go back a few slides? Actually, I don't know, probably keep going. I'll tell you, keep going. They had a bunch of X's in it.
Oh, yes, the matrix.
This one here. All right, 3, 2, what's all the different X's?
Yes, so that was, it's 1X has potential to reach the audience, 2X is likely to reach.
Okay.
3X is a higher degree. A blank doesn't mean that there's none, it's just not.
Okay. All right. I didn't see that on that. I'm sorry.
No problem. In the report is right underneath that chart
Okay.
on the same page.
And this chart was also in last year's communication plan. We just updated it now to include public engagement events, which will be a strategy in the warmer months when we can ensure the safety.
And
I had a question.
yes,
So on this matrix, the last little column all the way to the end is students and adolescents. That fits in with my question as relates to our overall strategy. So Facebook and Instagram, along with YouTube, are our online engagement pieces, along with the website. But in light of, I'm wondering if there's any benefit to exploring other platforms. Obviously, Facebook and Instagram were out for a few hours this week, but I'm thinking more in lines of those social media platforms that are more geared toward the students and adolescents, namely like TikTok or Snapchat. Facebook seems, even though pretty much everybody's on Facebook, at least the young people that I'm aware of are gravitating towards some of those other platforms because mom and dad are on Facebook. But I'm wondering, is there any thought process behind engaging that last sort of column here on the matrix piece?
Yeah. So we do understand, and Facebook and Instagram are, going into, we knew that they were kind of volatile platforms. The other with Facebook and Instagram, they have accessibility and built in, and it'd be completely different on Twitter. I don't know the accessibility. I don't even use TikTok myself. So I wouldn't know how to use it anyways, but those are Twitter and TikTok are kind of platforms, or Snapchat, that are like quick content, and our information is more, long-term, or more information that's digestible in a visible state. So those are kind of, up and coming platforms, but in terms of our, content that we like create and, direction of how we do our communications, the benefit of those would not be as significant. Also, those are content that is platforms that really need to be, you have to observe them all the time. And there are also platforms that can get out of hand in terms of the comment section, or direction of toxic direction of the content. So the Facebook and Instagram, they're monitored. Those other platforms can get toxic real quick. And that's the main reason why we don't utilize those. And also just our content isn't really best suited for those platforms as well. And we do recognize that social media is a toxic platform, particularly for students and adolescents. And there's in the process of developing a response to that. I've been aware of this, the research about Instagram being bad last week. And so looking at content, social media can be good. It's just how you interact with it. There's any positive environment, but also making sure you're using it properly. So there will be content in the near future about addressing youth and their use of social media. So that is, we're aware of it, and we want to respond appropriately to it.
And I think considering all the news media regarding Instagram and adolescents, I think we're wise if we're not monitoring it 24/7, that we have to be careful about that, in my opinion. So
I think we have comments available on Instagram, but there are systems in place that anytime there are comments, we get an email. So they are monitored. So they're not unmonitored, but if you have more platforms, they're
Right.
more likely to be out of control much faster.
I
So
agree.
Reverend Copeland, I would like to speak directly to your concern though, and say that we've been also invited to have a conversation with the Rockford Public School District about coordinated efforts. And so I think that's a question that we can ask when we're there about how we can better reach youth.
Right.
That answers my question, because the only reason I was asking about social media was because of what the young lady just said, what Chelsea just said, in light of what's come out about Instagram.
Right.
And more importantly, I'm just suggesting, and you already beat me to the punch, that maybe there's some more productive ways we can reach out to adolescents other than social media. So since we've got captive audiences through the public school systems and even the housing authorities, maybe that's a better way.
There's a few other strategies on the platforms we use to potentially reach youth more. So any other questions?
No, I'm going to suggest that we move on because Linda had to leave. We now just have a quorum and we have all these action items. So I'm wondering, the next agenda item would be the monthly activity report. Can we put that at the end of the action items?
Yes, we can.
Okay, I'm just going to forge ahead. We need to have a motion for the September meeting minutes. Okay, second. Harry?
Second.
Okay, so we have a motion for approval of the September meeting minutes in a second. I will take roll call. Mariana Body, aye. Dick Kunert?
Aye.
Dr. Copeland?
Aye.
Danielle Angelari? Mhm.
Aye.
Thank you. Dr. Bill Gorski. Dr. Terry Giardini?
Aye.
Tim Neighbors, Linda Sandquist, And the second action items is the past month meeting minutes with the corrections. So I'm going to need a motion again for approval, acceptance, I should say. Okay, Dick, a second.
Second.
Dr. Giardini, okay. So I will take roll call. Mary Ann Abadi, aye. Dick Cooner. Dr. Copeland.
Aye.
Danielle Angelari.
Aye.
Dr. Gorski. Dr. Giardini.
Aye.
Tim Neighbors. Linda Sandquist. Okay, moving into the next, which is more of a probably lengthy discussion, is the intergovernmental agreement by and between the Winnebago County Community Mental Health Board and Region 1 Joint Regional Planning Committee, Commission, I'm sorry. Jason, I'm going to let you lead this.
Okay, sure. So first of all, just to clarify, Region 1 Joint Regional Planning Commission is the Region 1 Planning Council. That's our official title as it was when it was formed. But basically, we've come up on the end of our service agreement that we had with the Mental Health Board from last year. And so it is time to renew that. And rather than renew it again with a short-term, essentially when we did a service agreement for you, we were using agreements that are boilerplate, and then we fill in the scope of language, and these are generally used for shorter term projects. As this has developed into a longer term program with an ongoing relationship, we felt that would be helpful for both parties to establish an agreement that better defines the scope and roles and relationships between these two parties and for the work that we've been doing. And so just a couple of things to note on this. Number one, that this was reviewed in detail with a number of, and I would say just largely formed by the Mental Health Board legal counsel. We did provide them a draft, but they did review it in detail and provided a number of suggestions and places for restructuring the format of the document to ensure that it was rock solid. So a couple of differences from how this compares to the previous service agreement is this will automatically update annually with approval of the work plan and budget so that we don't have to draft a new service agreement every year. Secondly, it'll allow for us to provide a budget, much like the grantees provide, where we itemize our personnel, fringe benefits, occupancy costs, and indirect rate costs. And so then instead of charging an hourly rate, which we were doing before, providing you the member rate of $85 an hour, you'll now get everything kind of directly at cost, and we'll just provide that budget on a monthly basis, just as the grant recipients do for your approval, and then that will go to the fiscal agent, the health department, for payment. And then the other component to this is, well, let me just say by changing the budget that way, it allow us to increase the number of hours that we're putting on this. I was very fortunate to have 2 AmeriCorps members and an intern kind of fall on my lap, so to speak, last time around. I was not so fortunate this year, despite recruitment efforts through 4 universities and 2 AmeriCorps programs. Chelsea's the last remaining AmeriCorps member, and she's going to be finishing up her AmeriCorps program in October and coming on board as full-time staff. So this just allows us to bill at rates that are appropriate for each person's salary level, and to allow us to have more time available to work on this program. And thirdly, this agreement also establishes a 180-day termination period, which the attorney advised as a way to ensure stability for the mental health board programming, so that while the old service agreement allowed for a 30-day termination by either party, this 6-month window would really give the mental health board time to prepare if for any reason there were need to move in a different direction by either party, that there's a nice window of time to establish a new arrangement. So just a couple of high-level highlights. If there's any questions, please feel free to ask. I'll do my best to answer.
And my comment is that I know for a fact that this is pretty much a legal document, because the lawyer spent so much time making recommendations and tightening up everything. And Region 1 has accepted this, but this is definitely a document that ensures that the mental health board is in charge. I mean, we put the budget together, we put the work plan together. Nothing happens without the mental health board authorization. And this stipulates it. So I think I wondered how Region 1 would feel about it after we got it back, and they're fine with it because that's how they operate. You know, we are just employing services from them, but it really puts us totally in the driver's seat. So, yeah, Dick.
I would like to make a motion that the county mental health board, we accept the agreement that has been proposed by Region 1 Planning as our working agreement for the coming fiscal year.
A second.
Yeah, absolutely.
Okay, any discussion, questions? Otherwise, I'll take roll call. Mary Ann Abadi, aye. Dick Cooner,
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Gorski, Dr. Giardini,
Aye.
Kim Neighbors, Linda Sanquist. Okay, so that has passed, and that is our agreement between Region 1 and the plan in our mental health board. Moving on to the operational budget for R1 planning services. I
Okay,
need a
well, oh, sorry. I apologize. Go ahead.
No, go ahead.
I was just going to lay the groundwork for this, but really this just builds off the agreement. With that agreement in place, there's a few things that we will add to our budget. And the reason for doing this, so in addition to the contracted administrative costs, which we've now itemized into direct personnel, direct allocated operational costs, equipment, and indirect costs, we've added community engagement, training, travel, and dedicated technology subscriptions. And so the new agreement will allow for those specific items upon approval of this budget to fall under our procurement policy. The reason for that is that currently I'm going to Mary Ann for an expense authorization for every penny that we spend for things that are already dictated as appropriate through the work plan. So this will allow, you know, if we're going to do let's say a $50 Facebook boost, and that's part of our communication strategy, we have the authorization to do that. We'll get a receipt, we'll submit it to the board for approval, but it won't have to go through Mary Ann to have her signature to authorize every expense. Now, things that are already directly billed to the mental health board will just stay separate from this, and will get billed directly to the mental health board. But these are things that were already going through we were paying for them, we've been paying for them, and then getting reimbursement. And so just that additional step of having to go to Mary Ann, that takes out one less step and lets us streamline some of this process. So that's what this budget is, and we would then update it on a monthly basis to the mental health board, provide receipts for all expenses, provide timesheets for all staff hours, and then that would go to, as it already does, to Mary Ann and Ed for Reverend Copeland for approval, and then submission to the fiscal agent.
And I might add to that what any expense that Jason's talking about, this is, we've already approved it in a sense in the work plan and also in the budget. Nothing is going to be additional funding unless it was brought back to the board and, there was some unusual circumstances. And I might add that, and I think it's important because, and I don't know if this is the best time to inform our board about this, but during the county board meeting, there was concern raised about the increase for R1 in our budget. And we in Illinois, for a mental health board, are the slimmest administrative margin by far. And the reason that they're even gaining this increase is we're going from 8.8 million to 15 million or maybe more in terms of our funded programming. So what they're going to manage is not already what is out there, but all the new funded programs. So certainly the workload is almost doubled for R1. So I would say that the tiny increase is, I couldn't believe that there would be any concern about it, but I wanted to definitely inform the board in case, you did not understand that there was, it was overwhelmingly approved, our budget was, but that was the concern raised. And actually there'll be a follow-up meeting with myself and Chairman Chiarelli and Dick Kunert, because Paul Arena is concerned about the increase in the budget. So I just want all of you to be aware of that. I think it'll be fine, but I think we want to make sure that we listen to the concerns and hear him out. But so any questions about that? I just wanted to inform the board about that. All right, so we now move on to the FY20. Oh, wait, I need we need a motion for the approval of the FY22 operational budget for R1 planning service.
So moved.
Okay. And Dick seconded. All right, any discussion? Hearing none. Mariana Body, aye. Dick Kunert.
Aye.
Dr. Copeland.
Aye.
Danielle Angelari.
Aye.
Dr. Gorski. Dr. Giardini.
Aye.
Kim Neighbors, and Linda Sandquist. Thank you all. Now we can move on to the FY21 Planning Service Agreement Amendment. And again, Jason?
Sure, and I'll just be brief about this, but in wrapping up last year's finances, I'll say in hindsight, it was probably not wise for me to put a month-by-month cap on the services because every month didn't require the same amount of service. And so it created a situation where we would end up having left about $4,500 on the table from our $163,000 budgeted for administrative services last year, because there were months that we were under the limit, but then there were many months that we were over the limit. So just to give you an example, October, January, May, and July were all months that we were under the limit, which created this extra amount of $4,500 unbilled. And then in the month of August, just that month alone, we were over 5,298 because the amount of hours that increased from managing the grant. So all this is basically to wrap up last year's financials, to remove that month-by-month cap, but to keep the same yearly amount that was in the budget of $163,000, but to allow us to, for the month of August, to basically just remove that cap and bill out the remaining balance on that previous budget line item.
Any discussion? Well, first of all, we need a motion to approve. Terry? Dr.
Sure.
Giardini?
Motion.
Second? Who's going to
Second.
second? Dr. Copeland. Okay. Now, is there any discussion or comments? Hearing none, I'll take roll call. Mary Ann Abadi, aye. Dick Kunert,
He's having trouble with his mute.
Aye.
no, good. And Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski, Dr. Terry Giardini,
Aye.
Tim Neighbors, Linda Sandquist. Okay, see, we're getting through these. The next action item is the FY 2022 Winnebago County Mental Health Board Communication Plan. And so Jason or Chelsea?
Chelsea, I think already gave a pretty detailed
She did.
presentation, what this entails. Just a few things added from our last round. We wanted to give you an update on how we've been performing and doing and some kind of high level ideas for this coming year and priorities. So that was the gist of it.
Yes, and I must say that was very informative, and it's amazing how much is going on and how the public can access our information. It really is impressive. So thank you for the work involved. At this time, I would need a motion for approval.
I'd like to make such a motion that we accept the communication plan for the coming budget year.
Okay, second?
I'll second.
Very good. Discussion? Hearing none. Mary Ann Abadi, aye. Dick Kunert?
Aye.
Dr. Cop- Thank you. Dr. Copeland?
Aye.
Danielle Angelari?
Aye.
Dr. Gorski? Dr. Giardini?
Aye.
Tim Neighbors? Linda Sandquist? Thank you all very much. And moving on to action item number 7, and that is the FY 21-22 funded program special conditions that have been met. And Jason?
Sure. So, with each of the work plans that were funded, there were some special conditions that were dictated. And so we are now following up on those agencies that have met their special conditions. There is nothing controversial in here. Most of them were them providing screening tools that we required them to have in place to ensure that the target population was being served. There is a 40-page report that accompanied your meeting packet that details evidence to support each of these special conditions. So again, nothing controversial here, just follow up on these are the special conditions that have been made, that evidence has been presented for.
Okay. And before I ask for a motion, I just want to compliment you again on the board preparation. It was so much simpler having the subsections, at least I could follow very easily. And thank you for doing that. I know it's a lot of extra work, but it's tremendous. Thank you. So at this time, I will ask for a motion so we can approve the funded program that the special conditions met.
Motion.
Okay, Terry Giardini moved and Dick Kunert second. Any discussion? Hearing none, I'll take roll call. Mary Ann Abadi, aye. Dick Kunert. I know he's going to say aye, but he's.
Aye.
Dr. Copeland.
Aye.
Danielle Angelari.
Aye.
Dr. Gorski. Dr. Giardini.
Aye.
Tim Neighbors and Linda Sandquist. Thank you all. And believe it or not, we're at my last, not mine, our at last action item. And it's the FY 21-22 funded program budget amendments. And they were all in our packet. So I will let Jason, do you have any explanation?
Sure, quickly, just RAMP was a program that was partially funded. And so while the scope of their work was already adjusted and reflected in their work plan, they have not yet updated their budget to reflect the partial funding. So their budget has been updated now to reflect the partial funding. And so it's just reduced to match the amount that we awarded them. And we have reviewed it and feel that everything that they have in their budget is in line with what the intent was to fund and what is in the work plan.
Okay.
Sorry, and on the second one, which is remedies, renewing lives, unfortunately, they had a clerical error when they filled out their application. So what they requested in their application was less than what was in their actual budget. And knowing that we did not have additional funding to give out this year, they were very kind in updating their budget to reflect the amount that they were awarded, even though that was not the amount they intended to request. So this is just, again, an update to reflect the actual amount that was awarded to them.
So I will need a motion for passage.
Well, I make a motion that this addendum be accepted on the grant for ramp
Okay, and remedies. It's both.
and remedies. All
Yeah.
right.
Mhm. So I need a second.
Hey, second.
Okay, yeah, there are very few of us, so that's.
I was waiting for Ed to jump in. I want to go, Ed,
That's
anytime now.
Yeah.
They didn't want to be greedy.
And Danielle. Okay.
Danielle, sure.
Yeah.
Okay, so any discussion?
I just
Hearing
want to compliment Jason and Chelsea for this. Because so if the public is watching, they're saying, do they really discuss these things? What we're doing truly is representative of the excellent preparation that these people are making around these issues to us as a board. And I really, really want to compliment them and give my appreciation.
I
I think that
that's
says a
well
lot right
said.
there, Dick. I agree. I think you've said it right there. And Jason, Chelsea, echoing what Dick said. Yeah, thank you. Thank you a lot. Appreciate it.
Yeah, we get the information in print. We can fully digest it, but it's something that we've all been aware of every month that we have a meeting. So it's great communication. So anyhow, we have a motion, correct, and a second. I'm trying to recollect. We've done so many motions. Did we have a motion for this exact? Yes, Dick, you did.
Yes, we did.
Okay, very good. So with that, I'll take the roll call one final time. No, we have adjournment. So Mariana Body, aye. Dick Cooter.
Aye.
Good.
Aye.
Ed Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski, Dr. Terry Giardini,
Aye.
Tim Neighbors, Linda Sandquist. There we are. We got through the entire thing. So we can move on now to discussion items. The only discussion item, actually, mine would fit better under other matters. So I am not aware of any discussion items unless anyone at this juncture would like to enter. Yes.
May
Terry.
I? Okay. Last year we did a little PSA with I think with you, Ed, and you, Danielle, with the upcoming holiday season. I personally thought those were pretty good, seeing them on TV. I understand now, Chelsea and Jason, I'm going to yield to you, but can we kind of do that again, but this time do it on our Facebook page? Doing things like that again, where we are looking into the holiday season about loneliness and, kind of getting our act together. And can that be done and put it on our Facebook page as opposed to calling another TV station doing it? I mean, with everybody in their Apple 13 and with the Pro and all that kind of stuff, doing it like that. Can we do it that way?
So I guess what I would have to say to that, and Chelsea might have her own thoughts, is that first of all, I think if we're going to do it, we should hire somebody to do the video, because the one limitation with last year's was just being a 15-second video. We didn't even get to say from the Winnebago County Mental Health Board. It was like, this is Reverend Copeland from 815 mentally fit, and I don't know that anybody identifies with that brand until we do more with it. So that would be something that I think we need to look into the cost of how much within our community engagement budget for the year, what would it take to actually have somebody make a video for us with board members? And then the second part I would say on that is we'd have to see how much time that's going to require to do that with having the video shot and how many board members want to participate in that. But I think we could at least start with that level of inquiry to see, I don't think it's a bad idea if as long as we own the video and we can push it through multiple platforms. But we do have a number of things coming up with the grant updates as well. So I just want to make sure that we don't bite off more than we can chew with that. Chelsea, I guess I want to volunteer my staff to do things when I'm also every day trying to keep us going here with getting this new grant updated for a November or December release. Chelsea, do you have any additional thoughts on it?
At the very least, if you guys have topics that you want to introduce, hi, I'm this board member, and you do a write-up, we do something like that at the very least. So if you guys have content that you want pushed on our communications, that can actually absolutely be done. So regardless, we can do something on that level. So, but yeah, we do have a lot in around that time of year, but we can see whatever the workload is at that time.
If you all want to record them on your iPhones and send them to us and give us the produced version, it'll be easy for us to push.
You know what? I might be willing to do that. I think I got some young people around here that could help do it so it won't look raggedy. You know what I mean?
Well, I think, I thought in my mind quite a bit about this because even though we are being requested now more than ever to give updates about the funded programs, and I think it would be useful, Jason, if you sent everyone on the board the presentation that you give, because it's wonderful. I actually it was virtual. Jason gave this presentation to the faith group that the mayor runs. The mayor had requested an update. And so I listened to this, and the attendance was excellent that day, higher than the normal number or average number that attend. And I just could not, here I am, the president of the board, but I was in awe of the information that he had at hand and the explanation. And there were a lot of good questions. But for the general public, I think that if we could somehow, I don't know how you do this, and that just shows my lack of creativity, but try to inform them of the increased access if they have a crisis or if they have counseling needs, and the Winnebago County Board has opened up access. I mean, that's about as creative as I'm going to get, so I'll stop there. But I don't know how to go further with it, but I've really thought a lot about that because I don't know how you communicate that to the general public. But I still get a sense that not enough people understand how many places they can go to now that they couldn't go to before. And they just call these places. So it may not have to be too complicated, but maybe just listing them, it's impressive enough. But anyhow, if we have ideas, we should submit them, but I just wanted to share that.
Like I said, I'm not, if anybody wants to do some volunteer activity on communications and help Chelsea get some of that work done. I can't imagine if she got content from you or got a video from you that we couldn't find a way to put it out, so.
Now, the other thing is, you said maybe we should hire somebody, maybe we should look into. I think one thing that we have not done enough is touting our own horn or blowing our own horn for the work
That's
that's
it.
already been accomplished. And I don't think we have to be our own champion too. I
That's
do
right.
believe that. I think sometimes we don't do enough of it. So anyhow, I'll stop with that, but that's what I was gonna say. So we'll leave it at right now. Jason will look into whether or not there's any money or enough money to do something, or if we should individually just kind
Well,
of.
I think if Reverend Copeland had offered maybe that he might be able to help.
Right,
This-
well, I'm all
I
for
think if
that.
there's a zero cost option, let's start with that.
I agree with that.
And then we can move from there. So Chelsea can connect with Reverend Copeland and I can help coordinate that. And we can see what opportunities there are to do something low cost and to.
Yeah,
Terry, I agree with you. It's nice to do something around the holidays and get a
I
more
agree.
positive message out. So we'll see what we can come up with for that and try to figure out something that meets our support capacity, ability, and also budget.
Good.
And then Mary Ann, just to remind you, we did curb the monthly activity report. So I don't know if we are done with discussion and want to.
Oh, yeah, we should go back to that. I'm so sorry. The monthly activity report. So I'm gonna let you just kind of expand on that.
Sure. So I added this as a standing item to the agenda because I didn't want it to just get thrown into discussion every time, because it actually is probably more informative for you at the beginning of the meeting to know. Although today, because of the how many items we had, we ended up doing that anyway. But to know at the beginning of the meeting an update of kind of the key activities of accomplishments over the past month and to shape what some of the priorities are for the coming month. Now that we have so much going on all the time, it's not as easy for me to connect with each one of you individually to give you updates. So I wanted to make sure that we had a mechanism that communication is happening regularly so that everybody feels like they know what's going on. So we just created a one-page monthly activity report. I won't go through every line on it. You have that.
Right, in our packet.
Sent out an email this morning.
Yeah,
But I will just touch on a few key things, which was, again, we spent a lot of time over the past month providing technical assistance to organizations to help them complete their quarterly outcomes reports. And it is my understanding or belief that all of the organizations did complete those for Q1. And now we are in process of creating a summary document for that, where we can have some first quarter report basically for what some of the early successes have been from these funded programs. So be looking forward to that in the near future. We did host our second Learning Network collaborative meeting, where all the organizations come together to talk about coordination of services. And so that was really, again, another great opportunity, very high attendance, multiple people from each organization showing up to participate in that conversation. We have started a prototype of a data dashboard that will be another way of reporting ongoing outcomes over time. So look forward to that in the near future as well. And then just on the communication side, in addition to the presentations we did both to the Mayor's Faith Leader group and also the Alignment Rockford Operating Board, we have another one scheduled this coming month for the Opioid Task Force. And we did the NAMI newsletter for their, I believe, fall, right, Danielle? Fall newsletter. Then in the kind of background, we've also been just working to get this next round of funding prepared. We're going to have to do another grant application. So we're kind of reviewing and looking at what worked well last time and what maybe could be improved. And so certainly we'd like to reach out to the board members, particularly those who did the reviews last time, and get your feedback on that review process so we can enhance that or make it, you know, a little bit, improve that if there's any areas that can make it improve for this next round.
You know, I would like to comment on another area that shows what has happened as a result of the grants for this board, and that is that 84-page report, the Winnebago County Sequential Intercept Map. If you look at that and think what that map would look like if we had not funded the programs that are listed on there. So I think there is absolutely no question that the progress that's been made in the managing of mentally ill people with the court system all the way through is vastly improved as the result of our initial grant cycle already. That is a really, you know, I loved seeing the progress that we made on that document.
I concur.
And Dick, and Marianne, I have to add, even the criminal courts now are spending, especially at the misdemeanor level, which is where a lot of our mentally ill people end up in custody, is trying to coordinate with the civil part of the competency process to get people out of jail and into treatment or not to jail at all. And I think that's in part because of our efforts in the mental health board.
Well, I saw a report from Judge Jason, you know the judge you've been meeting with, that he's really a mental health advocate.
Judge Gibbons.
Thank you. And he wrote out a list of what he finds outstanding, actually. And it was co-responder program. And maybe because you're on that committee or you attend his meetings, maybe you could speak to that just a little bit as a highlight, Jason, for our board.
Yeah, sure. Judge Gibbons really couldn't say enough about how the co-responder program is, and I'm not using this word lightly, but I think transforming the way that the court system operates as it's related to folks with mental illness and substance use issues. And so while we funded that program thinking about, you know, strongly about the first response component of it being at the crisis event, what's also happening from this program is that the co-responders, both the police staff and the mental health workers, are working together to review 911 calls each day and identifying situations that look like it may have had a mental illness component to it or a substance abuse component to it. So then they are going to court when some of these individuals are coming up in court and advocating for them to get connected to treatment. And the part that Judge Gibbons was really excited about was that if the judge says, okay, yes, I recognize that, I understand that this person needs to go to treatment, there's now a mechanism for a warm handoff. So that person can immediately go with the co-responder. They can go right to the Mulberry Center or some other place and get an assessment right in that moment. So, you know, prior to that, it sounds like without that warm handoff, when the judge did recognize mental health symptoms and said, you know, I think that the next step would be for you to get a mental health assessment and get treatment, there was no connection. There was no warm handoff. And so a lot of people fell through the gaps. And so that was the part that already I think was one of those unintended positive outcomes from this program, something we didn't even necessarily anticipate would come from this, that is doing incredible things.
It's amazing that that is happening. I mean, it's deflection.
I can, you know, as a firsthand, you know, observation of it, when I'm out there and the calls come in it's interesting to see what's going on. We're getting more and more deputies who want to get involved with that, and the co-responder and other people outside of that. It really has made a difference. I'll go to the call and I'll see it go right there happening. And I gotta be honest with you guys, we really did a good thing. We really have funded a really good thing. And it's
Well-
nice to see how that is, working. It still has, ways to go, but it's working. And it really is a good thing that we've done that.
But Terry, the big gap is now when we have somebody who isn't able to consent to additional or, is having maybe a psychotic break. But now what's happening as a result of the co-responder team is now like Prairie State getting family members, guardianship so that they can be involved and start. We're talking about involuntary medication orders for certain people who we believe, should be out of the justice system, and we're slowly moving those people out.
As I said, it's still ways to go,
Right.
but from what I have been seeing when I'm out there, it's been a nice thing to observe. And knowing, because when you hear the feedback, from the deputies or the cops in general, they're happy that this is taking place.
Well, and that's always historically, you beg, plead, and whatever to get into the system and with the mental health worker. And after a period of time, it takes about 6 months. Both doctors that have this happen in primary care settings, they can't work without a mental health professional, and police feel the same way. They need the expertise. And I think this is just so awesome that we are feeling, these individuals in the jail deteriorate rapidly. And it's the sad, as you all know, you all have experienced that. So, and seen it. And it's just remarkable. So we have
To
pat
make a motion
ourselves.
for adjournment.
Well, Dick, we are going to in 1 second, but I did want to bring up just some technical. Under the other matters is that we, in the last meeting, had talked about the fact that we have to update our bylaws to coincide with the new legislation. And I know Jason and his team are working on that. Jason, did you want to just explain a little bit about that?
Sure. So we spent a lot of this past month of the attorney's time on preparing this intergovernmental agreement. But I did set the stage with them to let them know that the bylaws are coming up, that those need to be updated, and also the funding policy and funding agreements for the next program funding year. We were going to review that with them as well and determine if there's anything that should be updated based on what we've learned over this past year. So just know that's happening in the background, and certainly we'll keep you all informed on that and send out some drafts when they're ready.
Thank you for that. And one final announcement. Because we are getting so many requests, I know personally I am, would you speak to our group? Would you do this with our group? I routed immediately back to Jason because in fact, we have the presentation. We want to have a consistent message. We don't want to be spread out, and we need to know, we have to vet the group in terms of, what is it all about that they really want us to do? Because we never want to get into a situation where they're going to be, just selling us on their proposal coming up or whatever the case may be. So I just personally have had Crusader Clinic, and then also I know the urban ministries. And so Jason has handled both of those, and we're happy to talk to any group, but we just want to make sure it's for the right reasons and that we're not there to, oversee this, pitch, I guess is what I'm trying to say. So it would be good if you get calls, and we hope, the board gets known to the public. That's great. that Jason can kind of help vet what they need and want, and then we can proceed. So that's all I have. So any questions or comments about that, concerns? All righty, and then the motion, Dick's famous motion for adjournment.
But yes, I make a move that we adjourn.
Second.
Second, who's Dr. Copeland? Okay. Roll call, Mariana Body, aye. Dick Kunert,
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski, Dr. Terry Giardini,
Aye.
Tim Neighbors, and Linda Sandquist. Well, thank you all. Thank you, Jason. Thank you, Chelsea. It's been a great meeting.
Thank you all. Yeah.
Bye, everybody.
Danielle, I'll see you on Friday.
Okay, who you're
Friday.
seeing who on Friday?
I'm seeing Danielle. I'm pointing
Oh,
at Danielle.
nice. Yeah, it's a mental health
Danielle, I'll see
rally.
you on-
Yeah.
Danielle's below.